Hi, good morning. This is Dr. Rutledge, and I thought I'd talk to you a little bit today about the lap band and some of the latest research. The lap band is becoming increasingly popular in the United States, and so we're seeing more and more patients choosing the lap band. And of course, there's nothing wrong with that. There's a lot of good things about the lap band. What we are seeing, and we're hearing from insurance companies, physicians, surgeons who perform the lap band, as well as from countries where the lap band has been present for 10 years or longer since it came to the United States, is the higher rate of lap band failures. And basically what happens over time is the longer you follow lap band patients, the more and more failures that we're seeing. So what we see are patients with nausea, vomiting, reflux, weight regain, slipping of the band, obstruction, blockage, and perforation. And so more and more patients every day are showing up, calling our clinic for lap band removal. The good news is the lap band is fairly easy to remove, usually adds about 10 to 20 minutes to the mini-gastric bypass, and usually those patients then can be relieved of the complications associated with the lap band. And that's a real positive compared to the Roux-en-Y gastric bypass, which really is pretty much irreversible. And you can hear some surgeons and some patients who will claim that the Roux-en-Y is reversible. A good way to test whether that's really the case is just call up your local surgeon's office who does Roux-en-Ys and say you're Mrs. Smith, you have a Roux-en-Y that needs a revision, and see if they'll accept you as a new patient. And what we found is basically, even though we get dozens of failed Roux-en-Ys every week contacting us for revisions or help, is that most Roux-en-Y surgeons are not willing to do a Roux-en-Y revision. On the contrary, though, the lap band is pretty easy to revise, and we like that. And like the mini-gastric bypass is also a relatively easy surgery to revise. So if you have trouble with your lap band, don't hesitate to call us. We'd be happy to help get that lap band out and get you converted to a more successful surgery, the mini-gastric bypass. It's Dr. Rutledge, and look forward to talking to you again soon.